The representative of the Ministry of Health of Vietnam reported that Deputy Minister Tuyen said that as of 15/20 January 30th, the Central Institute of Hygiene and Epidemiology had identified 3 cases of Vietnamese citizens who were positive for coronavirus. One person in Thanh Hoa is being treated for isolation in a local hospital. 2 people in Dong Anh area, Hanoi, are being treated for isolation in the Central Tropical Hospital. These 3 people who used different testing methods still showed positive results for coronavirus, Deputy Minister Tuyen said. Thus, together with 2 Chinese father and son who are being treated at Cho Ray Hospital, Ho Chi Minh City, Vietnam have recorded 5 cases of coronavirus infection. Up to now, some localities such as Hanoi, Ho Chi Minh City, Hai Phong, and Can Hoa have a lot of foreign workers who are Chinese but have not reported the number of returning workers, Minister Dung said. He proposed restricting cross-border transactions and, when absolutely necessary, closed the border. Mr. Dung also proposed limiting the organization of festivals. We only organize festivals, crowded conferences when really necessary, when feeling high security, the Minister of Labor stated. In addition, he suggested paying more attention to propaganda, implementing solutions to wear masks. Having been a person with many years of working in the health sector and as Deputy Minister of Health, Deputy Head of the Central Propaganda Department, Mr. Nguyen Thanh Long said that whether WHO has declared an emergency medical situation or not, we must consider this an emergency situation to respond appropriately. Regarding the proposal to close the border, Mr. Long said that there are no recommendations for closing, but we can apply similar strong measures, for example to stop accepting tourists, including single entry into Vietnam. In the south, travel from Vietnam to China and their localities are banned. Persons entering Vietnam for business or working purposes must strictly manage and supervise them and require them to isolate themselves at home, ban Vietnamese from crossing borders. According to Long, the disease is expected to last about 2 to 3 months. The virus is transmitted through 3 routes: is spread through the air, spread by contact with an infected person by touching an infected person or shaking hands, and spread by touching surfaces in public places containing the virus. Therefore, it is important to wear a mask only apart. Washing your hands with soap is important. Before the proposal for students to leave school, Mr. Long said that this method should not be applied but should thoroughly apply classroom hygiene, helping them to wash their hands with soap. Update the situation. The Ministry of Health representative said that in China, the disease has spread to 31/31 provinces and cities. By 7 a.m. on January 30th, the country had announced 170 deaths, 7,771 cases and more than 12,000 suspected cases. The number of infections and deaths skyrocketed in 24 hours, an increase of 38 people compared to January 29th. This number is expected to increase in the next 24 hours. In the world, outside of China, the disease has appeared in 17 countries, including Thailand, Singapore, Malaysia and Vietnam. The total number of cases worldwide is 7,819, with 170 deaths all in China.